Welcome to The Healthline, issues that shape our well-being. I'm your host, Dr. Andrea Ault-Brutus. In The Healthline, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving, complex healthcare system. Today, I'm very excited to have Fabian Arroyo on The Healthline. Dr. Arroyo is a native of Chile, where he earned his bachelor's degree in physical education, sports, and recreation in 2009. He also had a master's degree in education and a PhD in kinesiology with a focus on adapted physical education and disability studies. Since September 2024, he has served as an assistant professor in the Health and Physical Education program in the School of Education at Hofstra University. His research focuses on understanding the experiences of people with disabilities across various contexts, including schools and teachers' education programs. Dr. Arroyo, welcome to the Healthline. We're very excited to have you on our podcast.
Thank you so much. I'm quite excited to be here.
Thank you. So can you tell us a little more about yourself and what sparked your interest in conducting research that focuses on understanding the experiences of people with disabilities?
Certainly, that's a great question. As you well mentioned, I'm originally from Chile. My background is in physical education. I'm a teacher. I moved to the United States in 2010. And I worked as a public school teacher, in fact. And I worked in other healthcare settings before arriving to teaching also, so I have experiences there. While I was in Texas as a public school teacher, I was interested in getting my master's, so I did get my master's there while still teaching. And then in 2020, this great opportunity came up where I had the opportunity to go and earn my PhD at the Ohio State University with a fully funded opportunity through the Office of Special Education Programs. So that's how my PhD was funded. One of the major emphasis in that PhD was to work in adaptive physical education and disability in general, and doing work in the area with people with disabilities in the United States, in its territories, but also I think I've expanded globally to go and understand better the experiences of people with disabilities. My interest, it basically lies disability is connected within my own family line. Also, through my work, getting to know more about people with disabilities in different regions, in different parts of the world, and understanding how complex disability is. That's where my interest also lies. And I think all of us that do research, we have that level of curiosity where we want to try and understand a little bit more. And those that stand in the social sciences like me a little more, we want to know more about what people live and what it is like to be a person with a disability within different geographical contexts.
So you just started here at Hofstra in 2024, and you're serving as an assistant professor in health and physical education, and you also co-lead the dual program that allows students to get a bachelor's degree in physical education and a master's degree in health. So can you tell us more about that dual degree program?
Absolutely. So one of the things is that physical education and health is quite well connected. In physical education should provide some of the guidelines to live a healthier lifestyle, and that's starting in K through 12 settings. And that connection is well represented in our dual degree program, where students have the possibility to earn their bachelor's degree in PE, but also an emphasis in health. And what that leads to is getting our students certified in both areas, physical education and health, and be able to teach that content across through K through 12 settings. So it's a very unique opportunity. It's time saving, because it can be completed in 5 years, and they are allowed to take graduate level courses in health while they are still in their undergraduate level, which is a great thing for them. And again, they get to go out in the schools and get experiences in both teaching PE, but also teaching health, and providing this foundational knowledge to our children and youth about how to live a healthier life.
I'm very interested about your research because you emphasize understanding the experiences of those with disability. Can you tell us more about the research that you've been doing in the past and what you're currently doing now?
As you know, disability is centered in my research in many ways, in trying to understand what disability actually is and what that might mean to different people in different contexts. As we spoke before coming into the show today, I would like to highlight a couple of things that I've done. One of the things first is we were contacted by a university in Colombia in South America, and we were provided to do some research there with a blind student that entered the program to become a physical education teacher. Historically, physical education is a place that hasn't welcomed people with disabilities into these spaces. For us, it was a great opportunity to better understand the experiences of the student and also understand the experiences of faculty. So we met with faculty and student separately at different various times. One of the things that we learned there is that faculty tended to have lower expectations of the student with disability. And that's one of the recommendations we constructed also is we should not lower our expectations because of an impairment. And I want to make that distinction. Just because someone has an impairment, which is different than disability, probably that will be a whole nother show right there, but we should not lower the expectation. Another thing that we learned there is many times the student was being used as a resource, as an educational resource to demonstrate certain things to others, particularly persons without disabilities. And that was one of the aspects that we raised, and we said the student should not be an educational resource if he's not allowing it to be a resource. And so we need to ask for that permission, and we need to ask for their insights and their experiences and respect how they live their lives. The other thing that I wanted to highlight here is the use of simulations. Many times, faculty tend to use simulations to simulate an impairment, in this case, blindfold persons without disabilities to hopefully understand the experience of a student that it's identified as blind. And we certainly discourage that practice because impairments are not something that you put on and you put off daily. It is definitely something that many people live with this permanently, and they make their life in that particular way. And we should respect that. So the use of blindfold needs to have some form of pedagogical reasoning behind that. And we should not use that as a tool to fully understand disability. In fact, it will do the opposite. It will provide negative expectations or negative connotations to people with disabilities. And the other aspect that I wanted to mention is relation to a different study. I would like to highlight that this study was started with a good colleague of mine where she was interviewing women of color with trafficking experiences. One of the things that she started to hear from these women is that they all had IEPs when they were growing up.
And can you say what an IEP is?
An IEP is an individualized education program that is provided to a child that is diagnosed with a disability under IDEA, Individual with Disabilities Educational Act. Most of these women had those IEPs in place. So that raised the concern that most of these women, in fact, had disabilities. So that's when we came in with another colleague of mine. We came in and joined this project to better understand these experiences and how they enter healthcare services, for example. And I think this aligns well with this show here also. One of the things that we learn is that the intersectional nature of the experiences of people, where although she was interested in women of color with trafficking experiences, which is such a powerful intersection right there, but the disability could not be disregarded because that also led to forms of oppression and the way they were treated in these healthcare services. The other thing that we learn is that we don't know how to treat people with disabilities. And that also raised the question is, we might not have a full understanding of accessibility. So we welcome people with disabilities into spaces that have been philosophically designed for people without disabilities.
So when you say we don't treat people disabilities well, you mean like in just everyday settings?
Exactly.
Okay.
And I think we take for granted many little things or adjustments that we do, and we expect people with disabilities to feel welcome into these spaces. But many times it disregards their needs and it disregards what they actually need in these spaces. And that's some of the aspects that we understood in this particular study is their intersection of being women of color, having those trafficking experiences that cause trauma and other psychological effects perhaps, and those disabilities such as learning disabilities, while they provide them with a written document, that they might not have a full understanding of this written document. and nobody's willing to explain these documents to them within this healthcare services, then they feel marginalized, they feel discriminated, they feel left out of these spaces, although we're inviting them into these spaces. So in one aspect, I also wanted to highlight here is, and this is one of the lines that I'm certainly considering to continue to expand, is consider the voice of people with disabilities to inform practice, whatever that might be. Pedagogical practices, improve services within the healthcare system in the United States. It could be justice system. It could be translated into multiple systems. But how we actually go about to understand their experiences and give them voice to better inform what we do with them. It aligns with that movement, nothing about us without us.
Yes.
So how do we bring them into the space and we treat them with respect and we give them an opportunity, people with disabilities, to inform what we do as professionals?
So you talked a little bit about the research that you're hoping to do in the future. Can you talk more about what you are currently doing and what you have down the road?
The other thing that we are currently performing, we are actually doing some data analysis at the moment, is that we are interviewing deaf and hard of hearing persons in Mexico that are currently undergoing a physical education teacher education program. And we are examining the experiences within those programs, which is very similar to the blind student in Colombia. But at this time, we are exploring a different geographical region in a different disability. So that brings other nuances into how people experience those spaces. And some of the things that we are finding, again, it's people with disabilities adjusting to the system where people without disabilities live in. And I think that's quite crucial and aligns with how do we understand their experience and give them a voice to inform what we do. The other thing is they need to match levels of functionality that people without disabilities typically have. Let me give you an example. One of the things that some of the participants mentioned is that they were forced to speak. That was quite important to us to better understand and how people without disabilities still see disability as something negative, as something that needs to be cured, rehabilitated, and they need to match what persons without disabilities do.
Can you give us more context? Like they were forced to speak. In what situation were they forced to speak?
That's a great question, and thanks for letting me clarify that. So they were in practicum experiences, meaning they were teaching children spaces where they were observed by other faculty and perhaps other teachers. And many times, other professionals were, I don't want to say purposely forcing, but I think that's probably the best word that represents this case. They were forcing them to learn words and say words that would represent what they wanted to display within that pedagogical context. And that's quite problematic. And again, that raises a lot of questions, is how we treat people with disabilities. How do we acknowledge who they are and their identities that they bring with them? So that's quite interesting. Again, we're still not fully finished with that, but those are some of the things that are coming up and letting us learn what is going to lead the next work for us, but also the complex experiences that people with disabilities live on a daily basis also. That's an interesting piece right there.
Yes. Overall, for people who are listening to today's show who want to learn more about this area of research or just, in everyday life, what recommendations would you give people when they want to better understand the experiences of people with disabilities? Like what recommendations would you provide to people?
That's a great question. I think we don't have recipes.
Okay.
Because human experience is quite complex. However, I would definitely mention a couple of things. One of the things I would say is we need to have some level of willingness to be able to get to know the person with disability and trying to better understand what they go through and understand that there's such an individual experience and that doesn't compare to my experience or other experiences. In fact, we cannot normalize that visual impairment, for example, is experienced the same way by each individual with a visual impairment. So it's very important that we understand that. Secondly, we should definitely contextualize where disability is where we want to understand disability, meaning what context are we working on? Is this a classroom setting? Are we providing healthcare services to these individuals? What manner we want to provide information to them? Do we have different levels of information or different ways to deliver information to people? And I think with these recommendations, Andrea, more than providing answers, I think we have more questions, which is a good thing to have those questions. But again, if I could summarize everything, would be how can we center the person with disability to better inform what we do and how we treat them.
Great. Amazing. So for students who are interested in this type of research, or if they're interested in being a part of the dual program, can they contact you, or how can they go about finding out more information?
Yes, for those here at Hofstra, I'm located at the Dome, and my office is 112 there. Also, they can locate my profile on the Hofstra website at Fabian Arroyo-Rojas. They can definitely find me in the Health and Physical Education program. Find my email. I'll be super happy to speak with people. Perhaps those that identify with a disability here at Hofstra, maybe they want to find someone that they can speak about, daily things and nothing really major. I'm not a therapist. I don't identify myself with those professions, but I think I'm open to learn more about how they experience their lives and their educational experiences here at Hofstra. When it comes to work, there is a ton of work that my work aligns a lot more with disability studies. And I think that's an area that definitely needs a lot of attention because that can inform what we do in different spaces. So that's probably what I would say in the meantime.
Okay, great. Amazing. Any parting words that you would like to provide before we wrap up today's episode?
I would like to say that disability is more present around us than we actually think. I've been reading recently about disability studies a little more. And one thing that I'm learning is that those that we identify as without disabilities, it's only temporary. Many times we can experience impairment, perhaps disability in many various ways. And we need to be conscious of that. So I'm not saying that we have to experience that, but at any given point we can. The body that we have, it's only borrowed for a certain amount of time. That's some of the things that I will definitely encourage people to think about how they live their lives and how they understand their bodies also.
Amazing. Well, thank you so much, Dr. Arroyo, for coming to the Healthline podcast today. This was very enlightening and, helped me learn more about the importance of listening to the voices of those who are living with disabilities and understanding their experiences and how it can inform all of our different practices. So thank you so much for this information and this insight. So very much appreciate it. So thank you so much, everyone, for listening to today's episode of The Healthline. And we look forward to you joining us next time here on our podcast. Have a great day, everyone.